The next live speaker is Dr. Walter Mölk, who is a general practitioner from Austria and founder of the Austria Society of Ayurvedic Medicine. In 1996, Dr. Mölk became a member of the international research team at Maharishi Vedic University in Vlodrop. Dr. Mölk has developed comprehensive curricula for postgraduate training and has over 35 years of experience in teaching Maharishi Ayurveda to health professionals worldwide and has been involved in organizing international Ayurveda congresses in London, Rio de Janeiro, and in the Netherlands. He will speak on prevention is better than cure, the need for a prevention-oriented and integrative approach to healthcare. Here is your time, Dr. Walter Mölk. We're happy to have you speak to us. Thank you.
Thank you very much. It's a great joy and honor for me to connect to this conference and speak a little bit about the different approaches of Maharishi Ayurveda, and under the heading that prevention is better than cure. I will now share my screen. So prevention is better than a cure. The need for a prevention-oriented integrative approach to healthcare. So the first important point which I want to make is that health is wholeness and integrative medicine. This is a definition from the National Center for Complementary and Integrative Health from the National Institute of Health in the US. It's bringing conventional and complementary health approaches together in a coordinated way, incorporating complementary approaches into mainstream healthcare. Another important point is this integration, and then also personalized genetic medicine. That is medicine that uses information about the person's genes, the proteins, and the environment to prevent, diagnose, and treat disease. Maybe you have heard from this term P4 medicine, which means the medicine has to be personalized, preventive, predictive, and participatory. Personalized is clear that not every medicine is for every person, and we know because of different in the gene expression that some persons with the same medicine at the same dose either overreact or they have no reaction. So this is the outcome of genomic medicine, that we know the medicine and all the treatments have to be personalized. And therefore it's also preventive, because, and we come later to it, this is the great strength of Maharishi Ayurveda, that prevention is more personalized. And therefore also better, the predictive power of the diagnosis is greater. And participatory is very important. That means that the patient is part of the whole treatment and not only someone who follows some advice. And this development is reflected here in these different levels. From the, at the bottom, we have the metabolic and genetic network, which then appears in the physiology as a disease network. And then we know that different diseases are connected with several divergent network on the genetic level. And then not to forget the social network. In Maharishi Ayurveda, we go a little bit further even, because we include also the environment, cosmic influences, and at the basis we include also the theories of the unified field, which I will show later. But this is already created progress in modern medicine to have these different levels. I wanted to also to mention just recently, a few days ago, was an important event happened in India, where the WHO inaugurated a global center for traditional medicine. And the purpose is to combine ancient wisdom and modern science for the people worldwide, and to maximize this potential of traditional medicines to modern science and technology. And I heard that in Ethiopia, quite a lot of people are going to traditional healers and using natural medicines. So therefore, it's important to combine these different approaches, modern and traditional. And this is now recognized more and more all over the world. And just this center is a result of this trend. Now here, I want to show, and this is a basis for the understanding when we then speak about the different approaches of Maharishi Ayurveda. It's a so-called unified field chart of physiology, and it shows the hierarchical structure of our world. It starts at the bottom, the unified field of all the laws of nature. Physics tries to combine all these different forces, which we see here, the magnetic force, the weak force, and the strong force, and gravity, and the different particles, matter fields and force fields, and to combine in one theory. And then the idea is we have this perfect symmetric unified field, and then to breaking of this symmetry, different particles appear, which then form the atoms and molecules. And here, the first most important is for us, from the biological viewpoint, the DNA. And then the different proteins, then the different levels which form the cellular structures, the cell components, which then form the tissues, and then the organs, organ systems, and then the individual physiology, which is again part of a bigger thing, the physiology of the society. And the society even part of the ecosystem of our Earth, and then further the whole solar system. So there is this, we have these hierarchical structures. So on the left side, we have seen that from the point of matter, and now on the right side, we see a similar structure on the level of mind. These waves, which you see here, they represent the active thinking. And the process of transcendental meditation allows that the active mind settles down. And then we can see on the next chart, reaches the state of least excitation when we experience ourselves without any thought, just complete self-referential, silent consciousness, the source of all thoughts. And now what we see here, these are not two different areas. On the right side, the subjective approach, and the left side, the objective approach. They only appear on the surface difference, but they have a common basis. And modern science, we call it unified field of the laws of all the laws of nature. In Vedic science, it's called Atma, or the self, subjective science. And it's the same basis. And on the surface, then it appears as different. And so this is very important to understand when we speak about prevention. We have to cover this deep level of our existence in order to achieve sustainable effect of our treatment. Now, here we give an overview of the different approaches which we use in Maharishi Ayurveda. It's a multimodality approach. And again, on the left side, we have the different levels of health. Starting on the bottom, unified field or pure existence, pure being, then the level of the mind, the body, behavior, society, and environment, and the corresponding levels of health. So this is the total range of natural law. And when we want to achieve a state of health, individual and collective health, we have to consider all these different influences of health. So we said so far that health is wholeness. So all these effects have to be taken into consideration, and it has to be done in an integrative way, and also from the viewpoint of prevention. On the right side, we see now these different preventive and therapeutic modalities. The bottom, the influence from the cosmos, Vedic astrology, Jyotish and Yagya, then public health and world peace. These are large groups of meditation, people who practice advanced techniques of transcendental meditation to create more coherence in society. Then Vedic architecture, Vedic organic agriculture. And then the next areas are then the Ayurvedic areas in stricter sense, use of daily and seasonal routines, because the effect of the season on the health is different in summer or in winter or in autumn, and also the effects on the day and morning or midday or evening have different effects on our physiology. Then consideration of specific diet and herbal therapy, rejuvenation therapy, different types of massage therapy, cleaning, purification therapies, and then yoga therapy, yoga postures and pranayama. And then the use of all the five senses, Vedic aromatherapy, sense of smell, light therapy with gems, sense of sight, then the sense of hearing, sound and music therapy, then the model of Vedic physiology, which is a specialty, which I will explain a little bit later. And then finally, also meditation therapy. The goal of all these different therapies is to achieve the state of health. In the Sanskrit, the word for health is swasthya. Swa is the self, and sthya means to be established. So established in one's own self, this is the state of perfect health, the state of least excitation of our consciousness. Now, all these different therapies, here we have mentioned these different modalities in Maharishi Ayurveda, but this also includes all kinds of modern therapies or traditional African medicine or Chinese medicine or homeopathy, whatever. All these different therapies, the goal is to achieve or enliven the inner intelligence of the physiology. So to achieve health from inside out. We have to do both from outside in also, of course, with different methods, but the main thing is from inside out. To achieve this state of swasthya, state of to be established in one's own self. So this is a key feature, and therefore the practice of transcendental meditation plays a key role to achieve health and also to prevent any imbalances, because it starts from this basic level. Professor Nader has written this book, Human Physiology, Expression of Veda and Vedic Literature, where he combines the insights of modern objective science and ancient subjective science, and has shown that actually the sounds of Vedic literature, the frequencies of these sounds, are a blueprint for the human physiology. And therefore, the Vedic sounds can be used to treat imbalances. As I said, it's integrative medicine. We use most advanced diagnostic procedures combined with ancient traditional methods. Here, these are certain massage therapies and purification therapies, panchakarma, and then use of herbs. And this is also the great benefit of the Ayurvedic system, that it has a unique universal system to classify herbs. And I have looked a little bit about the herbs which are growing in Ethiopia, and many of them are also known in India. And even if not known, through the system of Ayurvedic classification of herbs, Dravya Guna, it's possible to classify the herbs and detect their influence on the physiology. Now, those who know a little bit about Ayurveda know we have these three basic principles, Vata, Pitta, and Kapha. It sounds a little bit unusual language, but it turns out this is a very practical, extremely practical diagnostic and therapeutic method to classify imbalances and herbs and daily routine and exercises. Very useful. One can also say these three elements. These are the information units in the body, the processing units in the body, structuring units. In Ayurvedic term, this would correspond to Vata, Pitta, and Kapha. I can in my lecture just give a few points, and of course all of this has to be then studied in more detail. One interesting aspect of Maharishi Ayurveda is Maharishi Nadi Vigyan, self-pulse diagnosis and diagnosis on the patient. Nadi means the pulse and Vigyan means knowledge. Extremely practical therapy, not only diagnosis, but also therapy, because to the attention of the physician on the pulse, also the first aspect of healing starts. And I can recommend every medical student and doctor to learn this technique of Maharishi Nadi Vigyan. So to summarize, Maharishi Ayurveda is not Indian medicine. It's also not alternative medicine, but it's integrative medicine and prevention-oriented and can be integrated in any system of medicine. It's based on one side, the Vedic science and technology, on the classical Ayurvedic texts, Charak and Sushruta and so on, and Dr. Nader's discovery of Veda and the physiology, and over 30, 40 years of research and clinical experience in all countries on the world. And also, it fits very well with the concepts of modern biology and medicine, genetics and epigenetics, and as I already have mentioned, personalized and predictive medicine. And also, its working can be very well explained with the system theory, self-organizing systems and chaos theory, and also with the latest concepts on physics and cosmology. So the principle is that the consciousness is the basis of our physiology, and therefore medicine is the study of the physiology, study of the body, along with the study of consciousness, because consciousness is the basis of the physiology. So this was a short overview of the different approaches of Maharishi Ayurveda and the importance to include all aspects of health and to start with that which is most basic, and this is our own consciousness. So I'm welcome if there are any questions. One thing maybe I could mention, for me as a medical student, I was fortunate to learn transcendental meditation, and it helped a lot for the study and to reduce the stress on examinations. And then later in the hospital, I worked in the hospital, it was a great help if you had a very strenuous night shift to recover more quickly. So it has very lot helped during the study and also in the medical practice. So I can really recommend it. And especially if you then combine it with learning self-pulse diagnosis and pulse diagnosis on the patient, and to learn these basic principles of Ayurveda, which can be easily integrated with whatever medicine you are practicing.
Yeah, here is a question. He has to come to the front to ask.
Okay, thank you very much. I'm happy to be participant of this interesting presentation. My question is, you have said that modern science have found the fabrics of immortality in human physiology. Is it something a hypothesis or real? I just need to know the extent to which it can be possible. And the other one is on about transcendental meditation, because of the fact that there is a mind tendency to project itself both to the present and both to the past and to the future. there is difficulty to practice it. So is there a way to prevent this flight of ideas or projection of mind so that we can do transcendental meditation appropriately? Thank you very much.
Yeah, okay. Yeah, I think this is an interesting question. Of course, immortality sounds quite strange and a little bit far-fetched, but this is meant that there is a level in nature which doesn't decay. And this is that what physics has found, that this is the level at the Planck scale where time and space does not yet exist. So therefore it doesn't change, it's immortal in that sense. Now the question is, how does this transfer to our physiology? We need to know that there is this basis is in every one of us. But of course, our physiology is subjected to wear and tear, but it depends how you will age and how long will the lifespan be, and what will be when you are older, how many diseases you have. So, and research has shown people who are practicing transcendental meditation, the biological age is much younger, and the process of aging can be retarded. This is also in line of these new findings of epigenetics, that the gene expression is influenced by what we eat, by what we see, and our whole environment. So therefore, if we change our environment in a favorable way, and also the collective consciousness has also to be more in harmony, then it's definitely possible to prolong the lifespan. How long, we will see. But it's clear this level of immortality is on the level of the unified field before any space and time appears. And the second question regarding transcendental meditation, I did not completely understand. Can you just repeat? It was that you cannot, the mind is always active and therefore it cannot, what was the question?
Yes, my question is just to practice transcendental meditation, there has to be some sort of consciousness, and there is flight of ideas, projection of mind to the future and to the past, so that it prevents us to practice the meditation properly. So is there a way to prevent that kind of mind projection so that we can practice?
I understand, yeah. So this is not necessary to prevent the mind projection. The mind can we use the nature of the mind. The nature of the mind is to go to something which is more interesting, and it goes usually always outwards. Now, in the technique of transcendental meditation, this direction goes in the inward direction. And there it is a natural way. When you see on this chart, these waves, the wave on the ocean, if they are led by themselves, then naturally they sink down. So it's a complete natural and effortless way. And there's no need to try to prevent the mind from being active.